How is Lewy body dementia different from Alzheimer's disease? Have you ever wondered how Lewy body dementia differs from Alzheimer's disease? Both are forms of dementia, yet they have unique characteristics that set them apart. Let's dive into the details. First, the underlying causes are different. Alzheimer's disease is primarily linked to the buildup of amyloid plaques and tau tangles in the brain. This buildup leads to damage and death of brain cells. In contrast, Lewy body dementia is marked by the presence of abnormal protein clumps known as Lewy bodies. These disrupt normal brain function in different ways. When it comes to symptoms, Alzheimer's disease usually starts with memory loss and cognitive decline. This decline worsens gradually over time. Lewy body dementia, however, presents a mix of cognitive, motor, and psychiatric symptoms. People with Lewy body dementia may experience visual hallucinations, tremors, and stiffness similar to Parkinson's disease, along with fluctuating levels of alertness and attention. The progression of these diseases also varies. Alzheimer's disease typically progresses slowly, often taking 8 to 12 years from diagnosis to the final stages. On the other hand, Lewy body dementia tends to progress more rapidly, usually within 5 to 7 years. In terms of clinical features, memory loss is a hallmark of Alzheimer's. However, in Lewy body dementia, memory loss may not be as prominent in the early stages. Instead, cognitive fluctuations and issues with attention are more common. Visual hallucinations are rare in early Alzheimer's but are vivid and frequent in Lewy body dementia. Additionally, motor symptoms like tremors and rigidity appear earlier in Lewy body dementia than in Alzheimer's, where they show up in later stages. Mood and personality changes can occur in both conditions, but Lewy body dementia often features more pronounced psychiatric symptoms, including anxiety and depression. Diagnosing these conditions relies on clinical assessments, cognitive tests, and neuroimaging. However, a definitive diagnosis for Lewy body dementia can only be made after death. Treatment approaches are symptom-focused. Alzheimer's is often managed with cholinesterase inhibitors, while Lewy body dementia may also require medications for Parkinson's symptoms and psychiatric interventions. Understanding these differences is vital for providing the right care. Individuals with Lewy body dementia may need more frequent monitoring due to their fluctuating cognitive states. Meanwhile, those with Alzheimer's might benefit from structured environments to help manage memory loss. In summary, while both Lewy body dementia and Alzheimer's disease are forms of dementia, they have distinct features, progression rates, and underlying causes. Recognizing these differences can guide effective diagnosis and management. Always consult healthcare professionals for personalized advice and treatment options.